more is not always better. And that's what you see in the biohacker mentality. More testosterone is not always better. More supplements is not always better. Working out 7 times a week may not be as good as 5 times a week. Everything in moderation, but doing the right things in moderation.
Dr. Paulvin was originally trained as an osteopathic doctor. He worked as a physician for 15 years. He holds certifications in holistic and integrative medicine, anti-aging and regenerative medicine, osteopathic manipulation, and medical acupuncture, treating things as varied as obesity and fibromyalgia. He has been featured on MSNBC, The Wall Street Journal, and Forbes. In his current practice, he creates 360-degree progressive programs to help you feel better, live better, and perform better.
I mean, the main things I would have to say is 3 things. It's going to be gut health, because the gut affects everything. We now have more and more testing of the brain itself, which obviously if your brain's not working, it's going to make life a lot harder. Third is really now.
Hi, my name is Chris Burris. I'm a longevity expert and the chief scientist at a lab focused on a longevity molecule. My primary focus is to help people live longer and better lives with science. Make sure to subscribe and share so you and your friends can live longer and better. Well, actually, so you and your friends can live beyond the norms.
Hi, and welcome to the next episode of the Live Beyond the Norms Health and Longevity podcast. I love it when I get a chance to have a conversation with bona fide physicians. I think there are things that less traditional, maybe new age practitioners may know better than physicians. Nutrition is one of the ones I think. I think we can start to get real value when we take the extensive knowledge of a trained and certified physician and combine it with where so much of healthcare and functional medicine and certainly anti-aging biohacking community is going. Our next guest, Dr. Neil Paulvin, is the expert to help us navigate both worlds. Dr. Paulvin was originally trained as an osteopathic doctor. He worked as a physician for 15 years. He holds certifications in holistic and integrative medicine, anti-aging and regenerative medicine, osteopathic manipulation, and medical acupuncture, treating things as varied as obesity and fibromyalgia. He has been featured on MSNBC, The Wall Street Journal, and Forbes. In his current practice, he creates 360-degree progressive programs to help you feel better, live better, and perform better. Dr. Paulvin, thank you for joining us today.
Thanks for having me. I need you to read my intro all the time. That was that's really good. I like that. It's a perfect voice.
You're welcome to cut that out. You do have to give a little credit.
No problem.
So I've heard a number of your interviews, and you obviously have a passion for delivering a holistic, evidence-based solution to help your patients feel, live, and perform better. What sent you down this path? Where did this drive to deliver value, specifically health value, to people come from?
Primarily, it's my own journey in the sense of when I was going through med school and then early when I was in practice, I had severe headaches. I saw every specialist, I think, besides a gynecologist at one point, and I was on all these prescription meds, and I was getting more side effects and really no improvement. And I'm like, oh, what do I do now? This is in the early 2000s when a lot of this stuff wasn't really in vogue yet. Now it's kind of every corner. And then I saw an osteopath and did some craniosacral. I started doing breath work, acupuncture, took some supplements, did some yoga, and I'm like, wait, all this stuff that I really didn't always go down the rabbit hole with, like, wow, this stuff actually works. And then I started implementing, I got certified in acupuncture. I added some supplements to my protocol. I was working more in a rural area where I didn't have specialists every 5 feet from me, like now in Manhattan. And so I did more of the functional route initially. Then I also went down the pain route. I was doing a lot of sports medicine. And then I did the anti-aging, kind of bloomed more and more as more and more things came available. And it just is kind of snowball after snowball after snowball. And here we are.
So to kind of peel the fabric back a little bit, right? So you were already studying medicine. Like, did you grow up in kind of a medical household? Like, what kind of pushed you in the direction of medicine?
No, I was the opposite. I had a kumbaya household. My mom's very spiritual, and doesn't really love doctors, to be honest, unless she has to go. I loved the puzzle. I loved trying to fix the problem or the kind of answer the question. So it was either going to be medical or law, because it was kind of like helping, kind of achieving a goal. I don't know how to explain it. And I like the challenge. And then I started realizing what was involved in law, and especially writing, which is not my forte. And I'm like, okay, I'm going to go to medicine. I love science. I was always good in science. It made sense to me. And that kind of how I ended up there. I like the challenge, I like the puzzle of kind of putting the pieces together and going from there.
And you may have just kind of answered this next question. Well, no, actually, here. You studied osteopathic medicine. This is a different course of study than a doctor of medicine or an MD degree. What is the difference between these two paths? I really don't have a clear picture. And why'd you go down the osteopathic versus MD?
So the way I always get asked that question, not as much anymore because there's more awareness. Back when I started, is I mean it's the same. We learn a lot in the same have the same practice, same abilities as an MD does in terms of we can do surgery, we can do injections, we can treat your sore throat, but they also believe in a more holistic, full body approach as opposed to some traditional medicine. Again, this is 20 years ago more than now. Things have kind of changed a little bit, actually probably a lot. Is it was okay, your throat hurts, it's this, or you have your low back hurts, then it must be something in your low back. It must be a disc. And then look at your hips or your knees, or maybe you have an autoimmune issue, or again, it was very focused. Again, that's one thing I liked about it. And the other part is there's a hands-on component. Not as many osteopaths do it today as did it 20 years ago. I still do some. I like doing it just on occasion. We're similar. Some techniques are similar to chiropractor. We do a lot of everything from similar techniques similar to stretching. We can adjust or crack like a chiropractor does. We can align joints, and I like that part of it as well because I had an interest in sports medicine. And again, some people come into, you don't want to always just give them a steroid or an anti-inflammatory. You can actually kind of address the problem with your muscle spasm or your hips are out of alignment or it's your low back. Let me just fix this and you're good to go. And I like the instant gratification there.
So it sounds like, what you really would like from the classic MD that you go to is if there are kind of more natural ways to try and fix this other than surgery, other than drugs, I wish they would go down that path first. And it sounds like osteopaths, that's their whole kind of mantra anyway.
But to most degree, I tell patients like my approach, and I would love most people to adopt is kind of play both sides of the fence. So yes, if there's something that's natural first, or even again, it could just be okay. You need to exercise more, or you need to go into a sauna, or do hyperbaric. Again, it could be 100 different things. Try that first, or in addition to maybe only giving the person one medicine rather than giving like 7 medicines with 7 side effects. But they may need a prescription med. They also just again may need physical therapy, or they may need to fish oil may fix their inflammation. So I think you need to kind of mix the best case scenario. Not my goal always is less medicine is better, less prescription meds are better in most cases because they tend to have more side effects than supplements or obviously like a sauna or something like that.
All right, so kind of last background question, then we'll like jump into the meat. So you went on to get certifications in holistic and integrative medicine, anti-aging and regenerative medicine, osteopathic manipulation, which I think was part of the first coursework, medical acupuncture. Many would have been and are satisfied with just the osteopathic expertise. Why did you think that was not enough? Like, why did you kind of continue to pursue these other modalities?
Because I love a couple of different things. I love having so many different tools in my toolbox because not one thing is going to help everybody. And because if somebody has back pain, again, if it's something that's you can only if you adjust them, it's only going to do so much. If they have an autoimmune issue or it's a gut issue or whatever you want to that's intertwined, you need other tools in your toolbox to treat that as well as treating the actual structural issue. So again, I always tell patients you got to turn all the keys at the same time to really fix the problem. Sometimes it's just a muscle sprain and that's it. I unfortunately love the shiny new toy syndrome sometimes where well that stuff looks really cool. And I think it has some application. Let's play. I don't like to sit around and just kind of okay, this worked 10 years ago. Let's just keep going with that. That gets boring and not always as effective.
And I think maybe if you described your mom as being a little woo, some of these things, I'm sure classic medical physicians are like, that's a little woo, but you were comfortable with that because you kind of grew up in that environment. Maybe that has some impact there.
Yeah, no, it helped kind of embrace it. Once I was in, I was in. I was sold.
I like it. All right. So you did a video about the 7 things you need to live your best life, and that video jumps immediately into the tests that you should be doing. Why do you have such an emphasis on testing, and has your focus evolved through your career?
Yeah, no, definitely. And what I'm kind of promoting now is, and we're in the prime, things have kind of hit prime time. What I tell patients is there's a lot of things that are hypothesized out there. We love to have 3D organs and cryo. That's not right for prime time. But now we're at the point where, in terms of testing, is we've kind of hopefully are trying to flip the paradigm. People who are quote unquote biohackers and or health optimizers, whatever we want to call them at this point, is that we can prevent disease as rather than having to catch up on the back end and say, okay, now unfortunately you have this, let's put you on blood pressure medicine, or let's deal with your heart disease. We can see where you are. So yeah, so I now believe that, there's tests for heart, there's blood work that's great. In the last couple months, there's blood tests to look for neurodegenerative and Alzheimer's. We can look for the proteins that lead to cancer issues or kidney issues. And we can look at, I'm not sure if you had some talking about like biological age testing. We can do microbiome testing. All that's can explain things. If you kind of deal with treating those issues, you may not end up with having some of the disease. You may have a healthy person who can live longer and healthier, because that's the key.
Has that changed, or have you been like early on in your career, testing was kind of key, and have new tests come along that you're like excited that are now available?
It's a newer thing because, like I said, a lot of that has really come available in the last 2 or 3 years. I was always a lab person. If I was evaluating somebody, I was always the person, or the phlebotomist hated because I was ordering like 15 lab tubes, because I kind of knew in my head it was kind of like a human algorithm. Okay, they're having this, so it could be this, this, and this. How do I test for those? And it just kind of was that. It was more that regard. And then I would kind of get, okay, this could be gut, but those tests all these tests weren't available 5, 10, 15 years ago. So it's really grown in the last probably 2 to 3 years.
What are you most excited about, kind of recent and potentially in the future?
There's a lot. Right now, I think the things that I'm really excited about are what are called the omics, especially, the epigenetic testing, which most people know is a biological age test. I don't know if you want me to name brands or not name brands. I don't know what
You can, yeah.
I used True Diagnostics, Glycan Age, give really good info in that regard. I now, again, something called metabolomics, which let's look at metabolites. And this seems like I'm a study junkie at this point, in the sense that there's a study coming out every week saying, okay, this metabolites increase your risk for diabetes, or increase your risk for Alzheimer's, or increase your lifespan. So we can test for those. When you have them, we can, again, be preventative. And now something called proteomics, where we look at their proteins. And same thing, we can kind of, and all of the people are going to be hearing more, every omics under the sun. Transcriptomics, secretomics, lipidomics. It's going to become alphabet soup after a while, but we can now, again, look at things to prevent. That's really, to me, the one thing I like. The one other controversial thing, I'm a proponent of a test called Clearly, which is a CAT scan of your coronary arteries on steroids, where not only we can look at all the plaque, and we can look at where it is, which vessel it's in. So it enables us, again, if we know somebody has, either people have a family history, we can know where they are, either good or bad, and treat it preventively. Or if somebody has, you could have an LDL of 180, and I could have an LDL of 180. You may have a perfect blood vessels, luckily, and my vessels, unfortunately, may be bad. So I'm going to treat you differently than I may treat me. I want to be more aggressive in terms of treatment. Again, mixing prescription and supplement, I'm probably not going to do as well just a supplement or natural exercise and lose weight approach, while you may be able to do that. So again, those tests can tell me where that patient is and what my treatment protocol is going to be in theory.
This just kind of begs the question. I think when you got started in your practice, you had access probably to an overwhelming amount of information, and then that amount of information has just continued to grow. And so like you're still, I think AI is, what do you think about AI taking a role in, if we're looking at all these omics and you've got this alphabet and then you start using AI to really like hone in on things? What do you think about that?
I mean, right now, AI in medicine is amazing. Again, it's because it's enabled us, and again, like I said, in the last couple of months or a year, we've gotten so many more studies because AI and machine learning, that whole category is now able to find things that we never would have been able to find or have taken years to figure out on our own. And in addition, again, it's also helping radiological studies. Again, testament clearly is I think a stat came out like radiology tests that use AI are like 30% more effective or accurate than not. So I think right now it's amazing. I think we may jump the shark at some point where we kind of get into Netherland or it just becomes too, where the computer's telling us how to treat patients completely. And that's where you may go into the a science fiction book at some point, but I think right now it's a perfect mix right now at least.
What do you think of kind of Aura Ring, Whoops? Do you have a favorite kind of regular data collection device?
I mean, I'm an Oura Ring fan. I think it's the most accurate. It has the most backing behind it. I mean, I think Whoop is good. People will tend to use like an 8 sleep as a lot of their data too. More data is good as long as you understand the pluses and minuses of it. I mean, if people will come in and say, well, I have this scale that tells me my body fat and so on. We just know that's not as accurate as a DEXA, but it's nice to trend and see where you are. As opposed to if you go get a DEXA, we know exactly kind of what we're dealing with. We know, I mean, even the head people at Aura or Whoop are going to say, hey, we know it's not 100% accurate, but hey, at least you know, okay, you had a bad night's sleep or your heart rate variability is poor. I mean, and we can work on that. But it's the trend, the big picture. You can't look at a day to day or hour to hour and micromanage. It's not helpful, and obviously can lead to more stressful issues than you need.
Yeah, that makes sense because I know in the middle of COVID, I was actually working with a consultant for Oura Ring, doing some sleep studies because our product tends to be a consistent testimonial. And if they had the baseline temperature, they could actually see the temperature rise like days before the actual temperature was, before any symptoms were even noticeable. And I think that's fantastic.
No, exactly. Yeah, it's definitely for that thing. Pulse ox it was also very helpful with. Yeah, no, it's great if you use it again. Like a lot of this stuff out there, use it for good, not evil. You can't let it. There are people who like live their life based on that, and that's not what it's for. But it's great to give you some insight of what you're doing and right or wrong.
Maybe not as bad as living your life according to a horoscope, but yeah, still it's controlling more than it should.
Hey, whatever works for you and get you the day. And again, you'll tell me now. I mean, there's health and there's everything out there. So whatever gets you from A to B, and it's as long as it's within reason.
Don't worry, be happy. So what are the most important things to test in your mind?
Wow. Okay. I mean, the main things I would have to say is 3 things. It's going to be gut health because the gut affects everything. I mean, on its own. I mean, there's gut skin, gut heart axis. There's a gut brain axis. The gut health affects everything. So to me, that's number one. We now have more and more testing of the brain itself, which obviously, if your brain's not working, it's going to make life a lot harder. And then third is really now we're in the sweet spot for heart testing. I mean, that's probably the most advanced of any testing that we can have that we know is really ready for prime time. So again, we can prevent heart disease and we can treat all components. It's not just about the cholesterol. It's about inflammation. It's about mitochondrial dysfunction. It's about endothelial or blood vessel health. It's all that combined. So I think those are the 3 things. Again, if your gut's not working, your brain has an issue, your heart's not working, some of the other more stuff, some of the other things aren't going to matter as much.
And so somebody who typically comes to see you is going to get kind of that battery of tests, or it depends on what their symptoms are?
Yeah, I mean, I see 2 types really. I mean, the simple answer is I see 2 types of patients. I see people who come in for what we call health optimized physical. They want to get this data and have the big picture, or I have other people who just have really long gut issues or hormone issues, and we're just doing more specific focus stuff. So not and then the one thing I'll say I've learned I've always asked people now, do you want all this information? There are people still who say, look, I want to live my life in a bubble. I just want the basic things, and I don't want to worry about stuff. And I get it. And that's how it makes them happy, and that's fine. They understand the pluses and minuses of it. So, but it depends what I'm saying.
Yeah, there are some who are like, my horoscope said I shouldn't be seeking data today, so so my answer today is no data.
Hey, we know the benefits of happiness and smiling may supersede a lot of this other stuff. So again, if it works for you, again, they know. I mean, I'm people who remember George Burns. George Burns smoked a cigar and ate salami every day, and he lived to 95. So sometimes just do what you do, and that's it.
So one of the things as I'm kind of preparing for the interview, I ask the kinds of things that you would like to be sure that I ask you. And one of them was regarding brain health. Why is optimizing brain health so important to you and to longevity?
Oh, I mean, I just have a lot of family and friends who unfortunately either have issues with Alzheimer's or post-concussion syndrome. And again, even a couple years ago, there really was not a lot of testing options or treatment options. And now, again, I'm actually coincidentally in a lot of WhatsApp groups, and we're debating like now the treatments have kind of gone from specific things that don't really work as well to, again, A, prevention, and B, taking the natural things and technology and merging that with maybe one or two prescriptions. So I just think we now are trying, enough people are speaking up that we're flipping the paradigm to a much big picture, which is, again, why I like being an osteopath to begin with. And I think obviously brain health is important, also just because, again, people, I mean, I do a lot of high performers, and if their brain functioning is 10% down, it flips them out. And that's important to me. I do a lot of athletes, obviously being mentally sharp is there. And again, also I deal with a lot of some chronically ill patients. Again, it could be unfortunately long COVID or post-concussion or Alzheimer's. And I just see that's one of those things where the patients come to me as almost a last resort, which is a shame. They've seen 7 doctors. They have a 6-inch chart. And it's just so demoralizing the family. They've been told there's nothing else to do except kind of supportive. And now we know there's things that can help them and maybe get back to almost where they started. So that's why it's important to me. And we know that we can do that now, as opposed to, again, 5 or 10 years ago, where it was a lot more supportive and meds that really didn't work that well.
So you mentioned kind of specifically Alzheimer. It's such it's this most terrifying disease. Like if you poll people, everyone is terrified of getting Alzheimer's. It's a disease that has kind of research dollars, 3.8 billion annually, 42 billion estimated over kind of the long haul. And really kind of nothing to show for it. But you're talking about in the last 5 years, like you've got, what are the things that can be done for Alzheimer's these days?
So a lot, and it's got to be a multi-pronged kind of program. I mean, again, luckily last week, a study came out. I think it was in Lancet showing 14 different lifestyle changes that can help either prevent you from having Alzheimer's or neurodegenerative issues or prevent it. And there are things that are very easy to do or free in most cases. Exercise, maintain connection, keep your brain active, control your cholesterol, decrease inflammation. If you have brain injury, treat it immediately, and so like other things on this list. So, I mean, that's the first part. Again, B is get the testing. There are now tests that have come out in the last 6 months that are very specific. You can get what's called, a p-tau, which is a form of tau protein. You can look at other forms of the proteins that cause Alzheimer's as well. Amyloid beta 42/40 ratio. We can look at neurofilament light. We can very specific neurodegenerative markers, and there's more. I mean, you can look at do an MRI of the brain. Then we also going to look at other causes now in terms like if you're low in testosterone and estrogen, that's going to lead to increased risk of Alzheimer's. If you have concussion issues, we're going to focus on the blood-brain barrier and trying to decrease the inflammation of the brain. And then we delve into, again, the prescription meds, which are probably the weakest component so far. And then, again, like kind of the mixed bag. We know a medicine called minocycline or doxycycline, which is an antibiotic, a generic's been around for 20, 30 years, actually decreases the inflammation in the brain. You can, and that's a great sign. We can use hyperbaric therapy has shown really great potential in terms of helping patients. Any biohackers heard of rapamycin has shown great potential. The GLP-1s like Ozempic, Mounjaro have shown great potential. Methylene blue, again, a biohacking favorite, showed potential. And exogenous ketones, I can go on and on and on of these types of supplements and medications, NAC and glycine and SS31. Again, we have to throw out a peptide if you're talking about biohacking. Again, all these different things. Again, it depends. Is it more inflammation based? Is it from a toxin? I mean, again, we now every day there seems to be a toxin thing that comes out now. I mean, as we're speaking yesterday, a study just is about to come out about how almost everybody has microplastics in the brain. We know it's everywhere else, of course, and that's kind of scaring the bleep out of people at this point. So, again, so I think again it's that combo approach, and we can now address all those things. Again, there's a lot of testing, and it's not what would help one person is not potentially the other person. I had a patient come in who has had 7 concussions, and that's their main concern. Another patient, unfortunately, was exposed to mold and other toxins for 20 years, and that was their big elephant in the room. So it's not one size fits all, but like I tell my patients is, and they like to hear it, is we can figure out what the problem is probably, almost definitely give you some improvement, if not reverse. I hate the term reversing Alzheimer's, but definitely dramatically improve it. And then you just see the whole family have this big smile because they've been told so many times that they're kind of hitting that brick wall, which was just so deflating to patients.
Hey, super quick break from the podcast. Hopefully you're loving it. This is a way you can support the podcast and take advantage of a great offer. We're offering 50% off of one of our MCT bottles. MCT is an amazing oil. Add the ESS60 molecule to it. It's even more amazing. All you got to do is leave a review on iTunes, send us a notification that you've left that review. We'll get you a coupon code that'll get you 50% off of our MCT oil and free shipping. Back to the podcast.
Yeah, and especially just as you look at it, kind of from the broad perspective of $42 billion being spent there. Is there anything somebody should be looking for, right? Like you also obviously have family history, but if you're concerned about Alzheimer's, I want to just touch on this a little bit more. What are there any, I don't know, behaviors or what might you be looking for to try and catch that early, or is it just, hey, come visit Dr. Paulvin, before you even think you need to?
Well, actually, what I was just talking about, that study that came out a couple of weeks ago shows that, if they have hearing loss, you need to be concerned. If they have problems visually, there's now going to be a vision test that's going to come out. It's in trial areas now that we need to be aware of. Obviously, if they have balance issues, it's to be concerned. Or unfortunately, again, if somebody has a head trauma, be it a sport injury or a car accident or something, you need to be aware that that's an increased risk as well. So those are early warning signs. Again, also the genetics. Anybody who watched the Chris Hemsworth special with Atia, whenever that was, a year or two ago, he's ApoE4 positive. He's now kind of unfortunately had to go down the rabbit hole of doing everything he can because he has like a 10 times increased risk of having it compared to somebody else who doesn't. So it's all of the above, but it's both doing both of those things.
I think they call Alzheimer's, they sometimes call it type 3 diabetes.
Mm-hmm.
So is insulin one of the kind of key factors you look at right away if somebody's kind of showing Alzheimer's behavior?
It's part of my routine. That was kind of not old school, but kind of one of the first things before we had a lot of other stuff that has come about. We didn't have proteomics 5, 7, 10 years ago. We didn't have hyperbaric, really wasn't available 5 or 10 years ago. Again, none of the really, I don't think a lot of people were even doing ApoE4 10 years ago. So yeah, it's definitely part of the brain's utilization of glucose is important. So insulin resistance in theory, can damage the blood-brain barrier, which is the blood barrier, kind of single or double layer cell between the brain and the rest of the body. You can have advanced glycation end products, which can lead to damage in the cells and the mitochondria and the microglia. So that's important. But it's not it's part of that 15, 20 thing list now. Is kind of, but it was, people talk about I mean, we knew a lot of the causes 10 years ago, but we couldn't really do a great test for it. You tried not, especially in that situation, you're not trying to, I don't know the word, not scare, but you want to make it even sound worse sometimes. So we can test for insulin resistance. We can check your sugars. We can check your hemoglobin A1C. Let's look for something that we can fix. If we find, again, if somebody was able before 10, 15 years ago, there really wasn't a great protocol yet. So I think that, but again, it's still important. Blood sugar is important. That's part of the reason that we're using meds like, again, we know that the GLP-1s will help. We think that metformin may even help a little bit. And because of that, part of that is because of their effect on blood sugar.
You've mentioned now a couple of times hyperbaric. I know that topic came up with a conversation you had with Amitai, who put us together. Very thankful to him. Talk about. I think you have a lot of appreciation for hyperbaric chambers. Talk about why you think they're so good.
I think they're. I mean, I think they're good because they are something that's not, there's no medicine involved, there's very minimal side effects to it, and there's so much good data on them now in terms of what they can help. If you don't know, you're going to this giant, well, they used to be all giant tubes. Now there's these really fancy ones where you can sit up and read a book or hang out with your partner, and a little bit different, but we are exposed to high pressure oxygen. But it's been shown, again, we know that it helps with long COVID, it helps with inflammation. If you have a rotator cuff issue, it's going to help that. So it just has so many great benefits. It may help with your sleep. It helps with blood sugar management. So it does all these different things for you, but just sitting in a tube for a half hour to an hour. So, I mean, it's passive and it helps your health. So why wouldn't you do it?
Yeah. And the protocols typically need to be, I don't know, a little bit longer, right? If it's 10 weeks or something. And then is they have these kind of soft-sided units and then the full steel units. Is there a pressure that the soft-sided units can't get to that's advantageous that a full kind of steel tube can get to?
Yeah, I mean, most of the soft chambers I don't really get above 1.5, 1.6. Usually, the harder ones are going to get to 2 and above. Some cases, if you need for the full medical issues like wound healing and things like that, you probably need to be above 2, if not higher. And that's not going to be achieved with the soft shells. I mean, those are more for just general health pursuits, not going to be something that's on the recovery side. So that's the main difference. And then in terms of duration, yeah, if you go to a place like the Aviv Clinic, which started in Israel now, has several centers here in the U.S., their protocols for brain injury and all are 10, 12, 3 months. So, I mean, they're intensive multiple times a week process, and that's the best. Again, I mean, I've seen patients who've done less and gotten improvement, but for patients who have serious illness, that's kind of where you need to get to, unfortunately, is you may need to be in there multiple times a week for an hour, hour and a half at high pressure. But it's kind of, you have to buy into that.
Well, and I think there's a little bit of intuition, like depending on the severity of what you're dealing with, it's just going to take time to kind of reverse that process because it's probably been happening over a long period of time. Another topic you wanted to touch on is a topic near and dear to me. It's mitochondria. It's near and dear to me because of our theory about how the molecule we work with, ESS60, kind of impacts the mitochondria. What do you see as the intersection of kind of mitochondria and brain health?
They're intimately related. I mean, we know that problems with mitophagy, which is kind of the recycling of the mitochondria, is going to lead to memory loss and potentially Alzheimer's. We know if there's oxidative stress to the mitochondria, it leads to brain issues. If there's a problem with less mitochondria, if the transport chain to where it produces ATP is not working as well, that's where things like methylene blue, and some people think there's problems with NAD, or we use MitoQ or CoQ10. All these things improve the effectiveness of how well the mitochondria work. And we know, so it's kind of an A to B to C thing. If your mitochondria is working better, we're either going to help your brain, the mitochondria in your brain just work better as a baseline, or we may fix a problem from whatever reason you had it, and that may improve that condition. So it kind of works both ways, is that either once, it's kind of like you just go for a regular checkup on your engine, go to the car dealer once a year, or if it's not working, you have to go to the cardio and fix it. So, but on both accounts, work on that mitochondria. I do a lot of red light helmet work now, which I was kind of skeptical about. I've just seen amazing improvement. That's targeting the mitochondria as well in different ways, in terms of complex 4, ATP, decreasing inflammation. We just know now there's such an intimate connection between mitochondria and all diseases. But again, brain issues, either just for biohacking or illness, had so few things helpful, and then training the mitochondria and improving it has just huge benefits. And this is something that we know works at this point.
So you've seen improvements with red light helmets in kind of cognitive function. Is that what I understood?
Yes, both for biohackers and for, I mean, I've had patients with post-concussion syndrome, Alzheimer's, ADHD. There's different programming for it, but on both counts, it'll work well. It works best when you're combining with other protocols, be it, again, supplements or prescriptions or so on. But it does, I've seen pretty quickly some decent improvement. It's a steady kind of progression.
And if it's a concern, you also get some hair growth out of that too, right? Like that's supposed to be one of the good protocols for hair growth.
Exactly.
So how much time do you spend thinking about the gut biome?
A lot more than I used to. But like I said, I have a lot of these things. I mean, it's about 95, 97% there. I mean, I think the last part is we're trying to figure out, and we were debating this at a conference I was at about a couple months ago, is microbiome the last step? Is it now we're learning that it's the postbiotic or the small chain fatty acids or some of the metabolites? Is that the final step in terms of really maximizing gut health? I mean, we now know there's definitely a link between either having a dysbiosis or abnormal either levels or balance in your gut microbiome. That's one of the 12 hallmarks of aging. That's important to everything. And the one thing I kind of still not sure how perfect it is. If people were saying, okay, if you have less or more of this one specific gut bacteria, you're going to have this or this. It's helpful. I think it's part of the whole equation. But again, we've seen plus, like they've done some trials with replacing it, and it's worked amazingly. Other times, either replacing it or doing what they call fecal microbiome transfer has not moved the needle for certain things. So I think we're this close. I mean, I definitely look at all my patients, be it physical or somebody's having an issue. I'm looking at it because it affects everything from sports performance to cognitive issues to almost everything like I mentioned before. So I check it on everybody. I'm checking small chain fatty acids, which I mean, if you're not taking butyrate or some form of it, I think you're missing the boat at this point. If you because there's just been so many studies based on that. But I think we know it's related to, again, the cognitive issues as well. There's definitely data there. We're this close. Now it's the question, okay, we have all this information. What's the most efficient way of going from A to B? And I think that's going to come out in the next year or two. I think AI is going to play a big part in that. And the last thing I'll say about that is now even infections like SIBO, which is kind of become a really popular topic, biohacker or not. And now there's new evidence, again, linked to mitochondrial dysfunction, surprise, surprise. And there's new protocols that are coming out, new treatments that are coming out. And that's related to the vagus nerve as well, which was a big factor between the gut and the brain health, which I've delved into a lot more with patients and seen amazing results by just working on their vagus nerve. So just throw that in there to make things more complicated. But the answer is I love it. I do use all the time. It's just, again, I would love it if we could just have a recipe. Okay, you have this is what we're going to do, and that's it. And we're just not there yet. Very, very close.
And some of it, I would think, is, I did a genetic test with a guy named Dr. Sam Shea, and, went through and it starts digging into, with genetic factors, understanding, does my physiology handle carbs well? Does it handle proteins well? And so there may be an optimal gut biome for different genetic kind of markers. We often talk about N of 1, but maybe there's N of 36, a random number. And so you really need to have your optimal gut biome is individualized for your actual kind of genetic makeup. Any thoughts there?
I think it's a half and half situation. We know you need, like, we know, again, we know you need to be producing enough butyrate. You want, in theory, have urolithin A, which is related. You're hearing about almost every day if you're a social media person, which is a post by some people, not by others. So you need that no matter what. But also, yeah, what's going to work, what you specifically need, depending on what you're doing, what your lifestyle is, it's going to be, and you're, again, back to the omics and all that stuff. It's definitely going to be a component of what you need is not what I need or my friend is going to need. So I think it's a half and half situation. I think that's what we're getting to. Again, it could be next year, it could be 10 years down the line. I think that's again, I think everything's an N of one. That's why I hate when you see these programs. Okay, you do this program from so and you're going to have the best health. And that's just not true. We know it's not true. I mean, so, but I think it's the future. It's just, again, how do we put those 50-50 pieces together? But I think there's definitely where we're going to end up.
And you mentioned butyrate and urolithin A. Do you think necessary to supplement with those, or would it be better to kind of optimize gut biome so that we're actually naturally producing those?
For butyrate, I supplement most people because most people are deficient, or if they I think it's partially because of who I see. Either if they're having a gut issue, butyrate helps. If they're having a brain issue, it helps. And most people I test don't have enough of it. There are probably people out there who don't need it. In terms of urolithin A, we know that I forgot the number. I think only 40% of people have the genetics and the microbiome to actually even make it. So in that regard, most people don't make, it's almost impossible to make enough of it. So that one, I pretty much would say everybody should be supplementing, because it's just, almost everybody can't get there. So I think that's my answer to that one. I get asked it all the time.
A question popped in my head and then just totally disappeared. I probably need more butyrate. Let me. That's my clue. All right. So if somebody out there is listening and they might want to reach out to you, right? I think you're mostly in the New York area or only in the New York area. But what would be the blueprint? Like, why might somebody? What's the kind of blueprint of your patients? Why might they? Who is typically somebody you serve well?
Well, I'm based in my brick and mortars in Manhattan, but because I have 22 state licenses, I do telemedicine pretty much throughout the country and the world. Which serves me well. It also gets very confusing after a while. But I see two patient types specifically now. Mostly, I see the optimizer patient who wants that doctor who knows what the labs know what's worth it, what's not, wants to know what tech is worth it. I'd say I'm like kind of that the translator on the top of the screen where I can say, okay, and explain to them what they need to do and what's kind of not helpful. Because otherwise the patients I'm on 112 supplements and I'm doing these three things. And like, okay, we have to clean this up. So that's the patient, half my practice. And like the other half of the practice I tend to get, unfortunately, are patients who have specific issues. I do a lot of gut, a lot of brain, and a lot of long COVID are probably the three ones I do a lot at this point. Who they've seen other doctors, or they appreciate the fact that I do have like that hybrid approach. Plus, I'm very tech heavy. If you haven't figured out from a lot of the other things I've said, I mean, I think a lot of the tech and the biohacking gadgets, I think, again, a lot of them have the data now where I don't look crazy from recommending sauna or hyperbaric, where a couple of years ago, doctors were like, what is this? And now it's like, here you go, here's every study, and they kind of keeps them quiet now, which I love. Trust me, it's like, which is again why, I mean, the doctors who are like 20 years behind just, it drives me crazy. Anyway, but yeah, so that's the types of people I see, and they find me, again, I probably get more people now finding me on Instagram or my YouTube videos and like just Googling me online, which again, it's a good and bad. It's kind of amazing. I heard you 2 years ago say this, and then, okay, it's kind of like, I'm trying to go back and think of what I said then. It's kind of funny, but that's kind of how patients find me.
Okay. You mentioned that you were kind of ahead of the curve with kind of some red light therapy, some hyperbaric chamber. Now the research is out there. Is there anything you're kind of doing doing now, or that's on your radar now that you're pretty convinced of, and also will probably in 5 years be back then I was ahead of the curve?
The best answer I can give you on that one is a couple things. It would be, I mean, I'm not personally doing it, but I refer my patients all the time for it, depending on where they are. Something called plasmapheresis or plasma exchange, which I think within the next 2 or 3 years is going to be everybody's going to be doing it because I mean, again, there's already data there. It was mostly just kind of getting it to the public, and now it's starting to leak out a little bit, which kind of is like the oil change for the body. And I think that's by far the number one proponent. I think the red light helmet and those types of protocols are going to expand, and but also again combine them with IVs and combining it with transcranial stimulation. I think again the tech, but it's going to be a stack as opposed to separate. I think that's kind of where we're growing in that regard. Those are probably the two main. Again, I mean the two main things we are. I think the last thing, which again I don't do, I kind of dabble with, is going to be the stem cell revolution. But I think it's going to become not the wild west that it is now. I think it's going to become much more standardized, hopefully in the next 3 or 4 years. Because the potential is we're this close to really nailing it down, where we can really help people both in local areas like your rotator cuff as well as like neurodegenerative issues, doing things like IB. So those are the three things I think people really need to be aware of.
And plasmapheresis is where you're taking your blood out, you're running it through some equipment. I know that I've seen some people who have done like ozone treatments of their blood. Does that fall into the same category?
That's EBO,
Okay.
or EBO2. That's a little bit different. This is actually a machine that's been used in the hospital for years for like kidney patients. They use it in multiple sclerosis, where they're taking the antibodies out and some of the toxins out, and then the clean blood's going back in. That's why it's literally almost like an oil change. We're now using it for patients again with long COVID. We're using it patients now who have very high cholesterol. We can sometimes clear the blood of that if they can't get numbers down on their own, and we check them again and their levels come down. Or also, again, I mentioned like microplastics and toxins. That's been one of the most effective ways to, again, kind of get patients hopefully back to close to zero again. Right now, just the price point is the barrier to entry at this point.
And you mentioned microplastics again. Do we have a sense of the negative impact that the microplastics are having on us?
How do I answer that?
I mean, it's clearly doesn't feel good. Like knowing that we have microplastics in our brain, we're like, this is not good. But
We're
do we have any?
scratching the surface. We don't know completely yet. Again, we know the basics, which kind of is assumed, and we know it's causing inflammation. It's causing mitochondrial dysfunction. It's causing all these different things that kind of happen when you're exposed to something foreign. We know that there's tons of hypotheses of how to fix it, or at least decrease it. But I think we're still 3 to 5 years away from knowing exactly what it's causing, what's the best way to treat it, and something that's available to everybody. Because unfortunately, it seems like almost everybody has it. It's not somebody who's just not random. It's almost everybody.
It's kind of interesting, like thinking from I'm not in the best position to have lots of data related to this, but these microplastics, they didn't start last year, they didn't start the year, like they started 15 years ago, and I don't know that we've seen some dramatic increase in any sort of specific conditions or whatever over the last 15 or maybe whatever the time frame is. So maybe they're not doing that. They're not helping, but there hasn't been some dramatic increase in whatever particular result from these. Any thoughts there?
I can't dispute that. I mean, it may not be a home run bad. It may just be like a single type addition. I don't, again, because otherwise, again, we'd see even 10 times the maladies or whatever. So I probably would say that so far. Yeah, I can't
But
dispute
not
that.
good. It just doesn't. It makes sense that it's not good, and we should figure out how to manage that. One last thing, and then I've got some wrap up questions. You mentioned stem cells. I think there you see biohackers and influencers going off to Mexico or Costa Rica or Panama. That's my preferred because my wife is from Panama, so that's where you should go to get stem cell treatments. Are there things that you have to leave the country for currently that you think you shouldn't be bothering with, and that you're hoping eventually come, or are there things that you have to leave the country for that you hope we can get and do here?
I mean, the main thing is the fact that all the quality processes for the stem cells are. I mean, every doctor I know from here to LA has an office, like you said, in the Caymans or Bahamas or Panama, and that's a shame because it sets the process back. It hurts people who can't get access to it, and it just opens up the door to charlatans, and you don't know who's good and who's bad. At least if it was done in the U.S., there'd be more organization and more regulation at this point. I don't understand. I mean, I do understand, but I don't understand why they're doing it this way. I think by far that's the biggest concern. I don't understand the ban on peptides here as well. Where people are now getting them from everywhere in the world at this point. Where we did have at least a system where they were somewhat controlled when they were done, where everything was allowed through compounding pharmacies. I mean, those are the main two things. I mean, in terms of things they don't need to travel for, I mean, I think some of these $50,000 woo spas are a little bit overrated personally. I mean, I like the process, but patients are like, well, I'm going to go to this place in Switzerland or this place in Germany. And I'm like, what did you do there? Like, well, I have this and this and this. Did they give you any answers? They're like, no, not really. They said just eat healthy and I'm gonna not eat gluten, and I'm like, okay. So I think that's the one thing. Again, each their own, and whatever makes you happy, A to B. But that's like my one concern is people kind of, again, that's where the influencer or the golden the cool golden object kind of scares me a little bit.
Yeah, it can get in the way. I think currently outside of the U.S., the reason you might need to go out is because they take your stem cells and they grow them, right? Like they multiply them, and that's something that you can't do in the U.S. right now. Any positive or negatives to that process in your mind?
That was one of the reasons. That's not as much the reason anymore because now what we're doing, what the doctors are telling me again, I'm aware of it. It's not something I do personally, for a variety of reasons. Yeah, that was initially the reason you could not manipulate the stem cell, which is important more, especially for local issues like not rotator cuff or a meniscus tear. What they're doing now is they're either getting embryonic cells from not a factory, but a plant, and that's being grown. So and you can't do that in the U.S. either. You have to do it out of the country. There's not other companies, another big time some doctors getting very proprietary cells in Asia, which you can't make here for the same reasons. You can't cultivate the cells. So there's offshoots of that now. That's the reasoning. We've gone 2-3 steps beyond that, and we're going to probably go 2 to 3 steps more. And I mean medical tourism is a thing in the U.S. and it's getting worse and worse. And eventually, we're not going to be able to catch up in the U.S. because patients who want it are going to travel, and then it's not good for the patient in some cases, and it just makes things a lot more complicated. But that's part of the problem, and again, it's just very frustrating. And I don't get it, but it's a whole nother conversation.
But basically, the techniques that they're using and that they have to go offshore to use, like you don't see any problems with those techniques. There's maybe advantages to those techniques.
Well, there's definitely it's like anything else. If you're dealing with the right people who are on the up and up, yes. I mean, there's definitely 5, 10, 15 different doctor groups that are doing the right way, and they're all doing it differently right now. You talk to Dr. A and he said this is the right way and he can back it up. Dr. B has his own way and it makes sense and they're doing it this way. There may be 7 ways to skin a cat. We're at the very infant stage of that right now. Anybody who's getting involved with any of these people are in the study. There's no proven data with any of this stuff yet. It's in the infancy and some people don't care. I mean, we're seeing that with things like follistatin, and people are getting injected with Clotho. And again, there's people like, I'll throw his name out there, Brian Johnson, who's putting the procedures out there that he are on the cutting edge, and everybody else is asking, why can't I do that? And first of all, he's a millionaire, billionaire. And like I tell people they see on these things is if they have a problem, they can go to the best expert in the world and fix it. Most lay people out there if they go to a bad doctor, they're just going to have the side effects and aren't going to be able to see the top doctor in the world for free probably and get it addressed. So be careful. But again, I think there's some really huge potential there. I think it just needs to be fine-tuned a little bit.
That makes sense. Well, you've been a wealth of information. There were so many points. I was like, we could go down that rabbit hole. It would be fun to go down that rabbit hole. Try to keep us on time here. My wrap up question. So here we can do this rapid fire. Do you have a target age that you want to live to?
No, I don't. I mean, in theory, I would say 80, but I don't live that way.
Okay. And how long do you think humans can live?
Oy vey. If you ask me this minute,
Yep.
I'm going to say like 110, 115.
And then in 20 years, what time frame would change the 110?
I think within 20 years, I would say 10 to 15, I think we're going to make a huge jump.
Yeah.
I just think the technology, I have no idea. I mean, I'm not,
Okay. Yep.
I would say between the 3D organs and AI and all this other stuff, I think we're going to be able to do all the things that we want to do. And we already know, again, what the aging process is right now. Now the question is getting the technology to fix it. And I think in 10 to 15 years, if not even sooner, because there's so much money, there's so many billions of dollars being poured into the space right now. I would not surprise me if it's closer to 10.
And then you think that gets us to another 20%, another 50%, another doubling?
Double.
And
I would
I'm
say
not going to
possibly.
hold you to it.
I would say even doubling.
Double. Awesome. I think that's kind of where I sit too. Like today, it's one thing in a shorter period of time than anyone's maybe even comfortable with a lot longer. What are 2 to 3 protocols, habits, mindsets? Let's call them shortcuts because everybody likes shortcuts to longevity and a long health span that you would share.
I would definitely say boosting mitochondrial health. I mean, I don't know if you want one specific thing. I would say, okay, I mean, that to me is number one. And then, I mean, number two is simple can be is high intensity exercise. I mean, it just literally. I mean, again, I would, like I said, I'm a study junkie. The study came out yesterday that just even being a weekend warrior improves your brain health like 20%. So, I mean, it's just, you have to do it. And it's not complicated, just do it.
Okay, that's you have a third you want to throw out there?
Morning sun.
I like that. And so boost mitochondrial health, is there like one or two things that you're like, here's what actually number 2 is going to be really good for it. But what might you throw in to say like, hey, you need to boost your mitochondrial health, you need to do.
And I'm not to say urolithin A. And I love it. And I'll just keep it simple.
And that's a mitophagy component, right? Yeah.
Correct.
Excellent. What are 1 to 2 things people get absolutely wrong regarding longevity and a long health span?
I mean, wow. Okay. I mean, the first thing is, I mean, there's, I guess a 2-part answer is there is not one specific thing that we know is gonna increase your lifespan at this point. It doesn't exist. We don't know it. There's hypotheses. That's what, so and so said that's like my biggest issue is, and then I'm trying to think what else in terms of what people get wrong. I mean, it's not really lifespan specifically. It's all these buzzwords that kind of come out, like adrenal fatigue is not a real thing, or there's these buzzwords that people. I'm trying to think what's another one I can think of. Like I mean, we're recording this. Cortisol face is going on viral. That just takes something to fix your cortisol and your hormones, and you're going to live better and lose weight and feel. And it's not true. And the last thing, actually, the one last thing I'll say is more is not always better, and that's what you see in the biohacker mentality. More testosterone is not always better. More supplements is not always better. Working out 7 times a week may not be as good as 5 times a week. So I think that probably is the overlining tenet is everything in moderation, but doing the right things in moderation.
Okay, so I jotted down like guru syndrome for number 1. Like there is, yeah, don't get sucked in, and then buzzwords or really kind of guru mentality of adrenal fatigue, just focus on cortisol, and more is not always better. I think those are great. Dr. Paulvin, how can people contact you?
People can contact me. The best way is either through the website, which is Dr. Paulvin, doctor spelled out, DOCTOR. That's the main way, or people reach out to me either on Instagram, which is Dr. Paulvin Simply, or they can check out my newsletter, which is coming back finally. It's been on my to-do list for a while, and now it's finally coming back. So I'm excited about answer a lot of the questions that you asked me, and I can just say, here you go. Read this article, and this is all the things you just asked me, and you can rehearse all the references to it. So
that's awesome. Thank you. What in the near future are you excited about?
Personally or longevity wise? What am I excited? I would actually say I mentioned a WhatsApp group. A doctor here in Manhattan has put together kind of the superheroes of longevity doctors, about 150 of us, and we have meetings like twice a year now. And I think what's great I'm excited because we are now finding what the problems are in the whole mechanism, and we're able to brainstorm, and we speak the language, not to sound cocky or condescending, but we know what we're trying to get to. And it's just been like exponentially increased all our kind of thought process. Instead of trying to do all this stuff, hey, what do we do about this person? What do we do about this hormone issue? Or what do you think about this technology? And we can say, oh, I know the owner of that company, and it's just exponentially increased it. And we don't feel like we're working kind of on our own. Because I'm here, there's somebody in France, we were talking with people in Taiwan, and it just brought us together. And then I'm like really excited because the head guy is set up in Cannes next year, and I've never been there. So I'm like, that's just exciting to be there, and also get to nerd out on some health and longevity stuff.
Man, I would love to be a fly on the wall in that group, because it would be fun. I've been in situations where future Nobel Prize winners are yelling at other incredible researchers in a symposium, right? And they're arguing real time, and those are unbelievably fascinating conversations. It's like great minds wrestling over great solutions. I think that's probably pretty amazing. All right, so you can find him, Dr. Paulvin, and that's doctor spelled out, PAULVIN.com. On Instagram, it's just Dr. Paulvin, or it's the full Dr. Yep, it's Dr. Paulvin, and then at his website, drpaulvin.com, find his newsletter. It's just come back from the dead. It's the Phoenix newsletter.
The Phoenix, yes. It's linked to all my social media, like I've never thought I'd be doing all this social media 20 years ago. It's amazing how things have evolved here.
It's amazing. Dr. Paulvin, thank you so much for joining us today.
I appreciate it. This was a blast.
I hope you enjoyed this episode of the Live Beyond the Norms podcast. Make sure to subscribe and follow. Also, make sure not to be that guy, the guy sharing this podcast with people who are not interested in living beyond the norms. If you would like to learn more about the ESS60 molecule, the molecule responsible for the single longest longevity experimental result on mammals in history, a full 90% extension of life, visit myvitalc.com. That's myvitalc as in carbon.com.